Hi, my name is Frida, and I'm here to tell you why LEAP is going to change millions of lives, and why I wish there was something like this when I was younger. As a child in the Democratic Republic of Congo, there weren't enough healthcare workers in my city, so when I fell ill, I could not receive the treatment I needed to survive. My mom and I went to the United States so I could receive care. She ended up becoming a part of the brain drain. I later became a part of America's healthcare workforce, and we both were a part of the Jaspera story. This isn't unique to the DRC. Unfortunately, the insufficient number of healthcare workers across Africa is a major issue. The African region has 1.3 healthcare workers for every 1,000 people, far below the 4.5 needed for the Sustainable Development Goals and the WHO recommendation. This workforce gap stems from another problem, which is the low acceptance rates into universities and the lack of affordable tertiary education alternatives. This is why we created LEAP, to provide an alternative for traditional higher education to help increase the health human resource capacity. LEAP is a healthcare e-learning platform for Africa. We collaborate with international organizations to provide quality and affordable healthcare education through a platform that is both mobile-friendly and intuitive. Our for-profit social startup is aligned with the SDGs in both good health and quality education and commits to making a large-scale impact across the continent. We are going to cover everyone. We educate healthcare workers and non-healthcare workers through short courses and professional certificates that are aimed to reskill and upskill already working professionals and help others transition into the healthcare workforce.
Our business model covers both fronts, B2B and B2C. On the one hand, we partner with universities and help them contextualize their content to offer it to African students. We negotiate a lower price that is well below other platforms' pricing. The student enjoys high-quality education and pays an affordable fee for it. The revenue from these certificates is divided between LEAP and the educational partner. On the other hand, we are currently creating paid subscription packages for B2B partners that want access to analysis of the local healthcare needs, e-learning preferences of African students, etc. There is no market like the African one. It's absolutely massive. The continent has 24 countries that share the English language. It has the fastest growing population in the world, and e-learning is currently booming. There are 137 million people that have a high school degree and are eligible to receive an education like ours. We are going to start in 4 countries that have proven to be in high demand of what we do. These are Ghana, Kenya, Nigeria, and South Africa. In these 4 markets alone, we are already looking at 67 million potential students for LEAP. On this slide, you can take a look at our team and see that we are well covered in the areas of expertise that we are going to need for LEAP's hypergrowth story. We have advisors who used to work at Coursera, we have an ex-Google collaborator, and many other talented and multicultural people working with us that have broad experience in relevant fields. In just a couple of months, we have made fast progress. For example, we received a grant from the European Social Fund. We have entered programs and partnerships with UNICEF, the London School of Economics, and many others. We have gathered a solid team. Our marketing efforts are proven to be very successful, and we have already received more than 500 leads that have signed up for our launch in September. The possibilities are endless, but we do have goals set from today until the next few years, starting by launching our platform very soon, then continuing to grow our educational and partnership catalog, and later on becoming Africa's largest healthcare e-learning platform. We have done all of this in just a few months with barely any money. And while we believe that being resourceful is more powerful than having resources, imagine what we can do if you support us financially. So we are currently raising 390,000 euros, and we would be happy to have you join the round. So please do get in contact with us, and let's create lasting health change together.